So before I see the patient, I'm going to collate all the relevant patient information, including reviewing the patient's case notes, the biochemistry, hematological reports and trends, hemodynamics and vital signs trends. Before I approach the patient, I will also check for the equipment that I need. The airway suction regulator is already being set up by the patient's bedside. I will need to bring in a 10 milliliter syringe and normal saline ampoules. I will also bring in PEEP valve and the pressure manometer for the manual hyperinflation. I will also make sure that the manual resuscitator bag is at the bedside along with the test lung by the ventilator. So before I enter the room, I will do my hand rub, alcohol rub, step 1, step 2, step 3, step 4, step 5, step 6, step 7. After I'm done with my hand rub, I'm going to don my PPE, starting with the surgical mask, apron or gown, in this case an apron, followed by my gloves. And I'll proceed to see my patient and set aside the stuff on the patient's bedside, establish the baseline ventilator settings, and the patient's vital signs trend, which will include the heart rate, ECG, blood pressure, and SpO2. Okay. So I'm going to introduce myself and identify the patient. Mr. Sim. Morning, Mr. Sim. Hello, Mr. Sim. The patient is sedated and not responding. Let me check whether this is the right patient. Yep, so this is Mr. Sim that I'm seeing. Mr. Sim, my name is Clement. I'm a physiotherapist. I'm here to do an assessment on you, mainly on your chest to assess your lungs, to see whether I will need to do some respiratory physiotherapy techniques on you. Is that okay? Okay. So I'm going to unbutton your shirt to expose your chest in order to do the assessment. Okay. So I'm going to put my hands on your chest to assess your chest expansion. Okay. And then next I'm going to take a listen to your breathing. Okay, so I'm going to continue. Okay, the other side. Okay. I'm going to slip my stethoscope towards your back. Sorry about that. And then one more on this side. Okay. Thank you very much. I will button fully later, okay, towards the end. So, sir, on this side, over this side of your lungs, I can hear coarse crackles, which is probably caused by the secretions that your lungs is producing as a result of the lung infection. So I'm going to do a few physiotherapy techniques to help you move the secretions out so that we can remove them from your lungs. Is that okay? So what I'm going to do is to put your bed down, turn you towards me, and I'm going to use a technique called manual lung hyperinflation, which means I will actually pump air into your lungs, which will help to move the secretions out from this region of your lungs. Okay? So, let me prepare everything first. in case I need to do suctioning, let's get this prepared. Turn on, set to 100 to 150 millimeters mercury. I'm going to open the syringe and open the saline ampule and draw out about 5 to 10 cc. This is for flushing the catheter after the airway suctioning. Okay, the filter and the pressure manometer. The manual resuscitator bag, which is connected to the oxygen flow meter. I'm going to turn it on to 10 to 15 liters per minute, ensuring that the reservoir bag is inflated and that this is working well before I connect and turn on the pressure manometer to check that it's working. Okay. Mr. Sim, I'm going to put your bed down and then I'm going to get my assistant to help us to turn you towards me, okay? So, put the patient down first. Thank you, Meredith. I need to put the pillow, I need to turn Mr. Sim towards me, okay, and then put the pillow under the back on his right side. Okay, so let me turn this away. Okay, ready, sir? 1, 2, 3. And this happened. Thank you very much.
Thank you.
Okay. Okay. So this position is to allow this part of your lungs to drain so that the secretions can flow out by virtue of gravity, okay? Let's check whether you need to be suctioned. There's no tactile parameters, there's no need to be suctioned at this point in time. Okay, I'm going to hyperoxygenate the patient and silence the ventilator. Mr. Sim, I'm going to disconnect you from the mechanical ventilator and connect you to this manual resuscitator bag. So don't worry, I'll be providing the breathing for you, okay? On the count of 3, 1, 2, 3. Okay. Just normal bagging. You doing okay? So I'm going to do 3 sets of 5 repetition of manual hyperinflation, okay, with an inspiratory time of 4 seconds and 2 seconds inspiratory hold. Okay. On the count of 3, we're going to begin. Take the deep breath. 1, 2, 3, and go. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 1. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. Okay, one more time. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. And then intermittent bagging while we wait for the next set. So all the while, I am checking the patient's facial expression for comfort or discomfort. I'm also making sure the vital signs and the monitors are steady and stable. While I'm doing the MHI, I'm also looking at the pressure manometers to check that the pressure that I am delivering to the patient's lungs is not more than 40 centimeters of water pressure. You ready for the next set? On the count of 3. 1, 2, and 3. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 1. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 2. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 3. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 4. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. Okay? And intermittent bagging again. One more set, Mr. Sim, and we'll be done. Okay, ready? And go. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. 2 more. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 5. That's it. Okay. Mr. C, I'm going to reconnect you to the ventilator on the count of 3. 1, 2, 3. Okay. And then checking that the ventilator is working. Okay. Let's check whether you need to be suctioned. Yep. I can feel some secretions, the tactile parameters in your central airway. So again, 100% oxygen and silent. Mr. Sim, I'm going to suction your airway. I'm going to put this catheter down your breathing tube, which will make you cough. So bear with me. I'm going to insert the catheter all the way down until I meet some resistance. Okay, then pull back a little bit. Apply continuous suctioning on the way out. Withdraw the catheter all the way. When I see the little blue tag, I know the catheter is all the way out, and I will monitor the amount, consistency, and color of the secretions. I'm going to hyperoxygenate the patient and silence the ventilator. Okay, doing all right? Okay, vitals are okay. Let's check whether you need to be suctioned again. Nope, all clear. Very good. Check that the ventilator is working. Okay. So I think that's it for our treatment. Let me put things aside and I'm going to reposition you, okay? Mr. Sim, I'm going to lift the pillow behind your back, but I'm going to raise your head so that you are to about 30 to 40 degrees. Okay. I'm going to make sure the ventilator is working and is as it is. Okay. And I'm going to evaluate the patient. I'm going to take a listen to your breathing again, okay? Okay, slide to the back. Okay, great. This part sounds much clearer now. So thank you very much, Mr. Sim. I'm going to button you up. And then I'm going to clean up the area, and that's it for the session today, okay? So I'm going to check on you in a few hours to see whether you have accumulated any more secretions in the lungs. And then maybe we have to repeat the treatment again, okay? Later on. Clean this up. Okay. So I'm going to clean and flush the catheter. So with the normal saline in the syringe, I will apply suction first and then inject the saline to clean the catheter. Okay. Once it's done, with the extra normal saline, I will pour it down the tubing to clean the tubing. Okay, so once everything is clean, I will turn this off So after cleaning the catheter and the suction tubing, we're just going to tidy up the place, making sure the patient is comfortable and that all the lines and tubes and drains are in place. So that's it. So after seeing my patient, I'm going to dig out. I'm going to first remove my gloves inside out and do a hand rub. And then followed by removing the apron. Also turning it inside out, followed by hand rub. And then lastly, removing the surgical face mask. And I will proceed to either hand rub or wash my hands with soap and water.